Hi, good evening, everyone. It's good to be here today. My subject is very, very simple. Okay, I know there have been a lot of heavy subjects spoken about today in terms of oncology and everything else, which is great. I'm not here to speak about alternative medicine. I'm here to speak about the integration of lifestyle with treatment. Medicine can be very powerful, but medicine alone without the changes of lifestyle is only a symptomatic approach. We have the possibility to address the root cause of the problem. So while medicine works, we can also change the potential root causes of diseases. The fascinating part of science and research today is the research about the importance of sleep, nutrition, exercise, emotional suppression has always existed. So it's really funny when we come across people saying that, oh, there's no science about it. It's existed for 15 years. Sleep deprivation and the correlation between inflammation and cancer. It's existed for 8.5 years. The existence of traumatic suppressed stress with prostate cancers and ER-positive breast cancers. So while we look at chemotherapy, radiation, surgery, which is all very necessary, immunotherapy, targeted immunotherapy, we also have to start looking at the lifestyle of people. How well living? The biggest statement, and I was in California 2 weeks ago speaking to doctors about the same subject. People say, we don't know why cancer happens, but we do. We do know what cancer happens. We know that when you understand the process of angiogenesis, we all know that every single cancer, from a liquid cancer to a hormonally driven cancer, is based on overangiogenesis. Which means most people after the age of 30, 40, 50 have microscopic cancer cells in them, and we can live with it until one of these cells hijacks a blood vessel and now has its own nutrition and oxygen supplied to it. And you can have a small microscopic harmless cancer cell become a tumor, a deadly tumor, in a couple of days and weeks. So we do know it is a breakdown of the angiogenesis defense system. Now what we don't know is what causes a breakdown of angiogenesis in the body? So when we look at a heart attack, when we look at the buildup of plaque, when we look at the inability of the capillaries of the heart to form new networks of blood vessels when someone has a blockage which is even 90%, what do we understand? Those are cases where angiogenesis is weak. Your body doesn't have the ability to grow healthy blood vessels. And in cancer, it's the opposite. What we also know is the documented research, which has existed for years, on certain foods that can stimulate angiogenesis and that can reduce angiogenesis. So absolutely yes, every single cancer, we know at a functional level what the issue is. It's a breakdown of a very fine defense system in the human body, which is called angiogenesis. We also know that there is faulty DNA. We also know that there is research today with scientifically and medically documented foods that can help the DNA repair. Alone? Absolutely not. You still need your treatments. But can they be supportive functional foods? Absolutely yes. Then we have stem cell regeneration, which a lot of people don't like to talk about because they immediately think you need to go to a clinic where you need stem cell injections. I'm not talking about that. I'm talking about scientifically reviewed foods that have the ability to regenerate stem cells by having a positive impact on your bone marrow. Then we have the microbiome, which is your gut. For the longest time, people separated the gut from human health. Today, we understand that your microbiome plays a huge role in your immune system, inflammation, your neurotransmitters, and basically everything that is connected with disease. And then finally, we have the fifth pillar, which is immunity. And of course, there are people Googling foods like, oh, let's have more turmeric. Turmeric is great for immunity. No, it's actually useless for immunity. It's not about boosting an immune system. It's about training your immune system to work the right way. So now, when I explain all of these things, there are the smaller aspects which are very important. Sleep deprivation. We all know, every surgeon knows, that the patient after incision will heal better in a state of rest. Because all healing, all wound healing can only happen in a state of complete rest, which is sleep. Then we have emotional suppression. Today, when you look at 97% of the ER-positive breast cancer cases, and the amazing research that is now documented of most of these women having a deeply rooted emotional event in their life, which has been suppressed. In our country, it could be a young girl who was raped or molested as a child and ordered never to speak about it. Or you could have other traumatic events which have built up as suppression. We understand today medically that every suppressed emotion has to surface. It can surface into violence, crime, a tumor, an Alzheimer's, a disease, or anything else. So the clear connection of the emotional state of mind and the physical state of the body has been established and documented. So what does this give us? Beyond all the treatment that we have and the advancement in medicine, it gives us hope that there are other things that we can look at beyond our treatment, not as an alternative to our treatment, but beyond our treatment. Nature, sunshine, exercise, the right exercise. Not too much, not too little. My sleep cycles, the circadian rhythm. What is the circadian rhythm? Light and dark. Today we know angiogenesis is impacted with a disrupted circadian rhythm, which means if your circadian rhythm is disrupted, it can affect how angiogenesis works in your body. It's scientifically documented. The food that we eat, nutrition is very, very hyped up. Nutrition alone can never cure cancer. Nutrition is a support functional method. We understand during chemotherapy, there are certain class A vitamins, minerals, which will be depleted from the body. Integrative nutrition and oncology means knowing which drug is depleting what and putting that back into your diet. So that way you reduce the collateral damage done by the treatment that you have to take. And you also maintain strength and homeostasis for the patient through that. The right kind of exercise. Too much, too little. A lot of people want to over-exercise during their treatment. We understand the buildup of lactic acid can also create inflammation in the body. So what exercise, how much exercise to do is also a huge possibility that we add. Sleep. Let me break it down and connect this with stress. You have the sympathetic nervous system and you have the parasympathetic nervous system. It is impossible for the body to heal, regenerate, repair, and grow when you are in the sympathetic nervous system. All regeneration, all growth, all repair happens in the parasympathetic nervous system. Stress is the sympathetic nervous system. Parasympathetic nervous system is rest, digest, relax. I'm not saying you're going to get cancer or fall sick or not get better if you're stressed out. But the longer you spend time in the sympathetic nervous system, the more compromised you are. The more time you spend in the parasympathetic nervous system, you automatically activate the intelligence of the human body, which is regenerate, grow, repair, all of those particular functions. So yes, we can get stressed, but it is up to us to decide how long we're going to stay in the sympathetic nervous system. That's why things like meditation, reflection, expression of emotions which are suppressed, nature, sunshine, all of these things play a huge role in the parasympathetic nervous system. Let me give you an example how being in the sympathetic nervous system will impact even the food that you digest. Have you ever tried eating when you're angry and stressed? Have you realized how your body feels after that? Indigestion, bloating, acidity, burps, and all of that stuff? Because you cannot digest when you're in the sympathetic nervous system. The parasympathetic nervous system is rest and digest. So when I'm in the parasympathetic nervous system, my body is primed to digest and to rest. Can you fall asleep if you're thinking a lot and stressed out? Impossible, because you're in the wrong nervous system. This is science. This is anatomy. So when you look at the vagus nerve, a lot of people say, oh, there's no gut connection with the brain. Part of anatomy and medical curriculum is the HPA axis. I'm going to take a moment to get a little technical over here. What does HPA stand for? Hypothalamus, pituitary gland, P, A, the adrenal glands situated in your kidney. Stress, hypothalamus brain function, and the pituitary gland, hormonal secretion. It's an axis, it's a network. Anything goes wrong or stimulates any of these things, it's connected with every single part of your body. So when you look at vagal tone, when you look at stimulating the vagus nervous system, what happens? You automatically move into the parasympathetic nervous system. allowing your body to regenerate, grow, and heal. Does this mean it puts your cancer in remission? Yes, there are possibilities. With the right treatment and the right lifestyle changes. How do we know this? Data. Some people survive, some people don't. Some people go into remission the first time. Some people take 5 to 6 treatments to finally get into remission. Some people never get into remission. The same stage of cancer, the same treatments, because it brings me to my last point, because we have 4 minutes left. Bio-individuality. This is where healthcare misses out the biggest point. It's not to blame anyone. It's the way all of us have been trained. Me in integrative medicine, you as doctors. Every human being is bio-individual. What makes us think the same medicine, the same food, the same amount of sleep can work for everyone? Which is why patients react differently to different treatments. Of course, there's gene and everything else, but you can't say everyone should sleep 8 hours. Some people are primed to sleep for 6 hours. You can't tell everyone that carbs are bad. Some people are carb efficient in the morning and not carb efficient at night. Some people are carb efficient at night and carb efficient in the morning. Do you blame the carbs? Or do you blame the fact that we put human beings in a box and we're expecting them to demonstrate results from a box? But when we look outside of the box, we understand that everyone's unique. That's why biometrics works. There is no 2 identical thumbprints even on twins, which makes us think, with science or without science, how can it always be the same? It can't. We can't force someone to sleep 8 hours when 6 hours is enough for their body type. We can't force people to give up carbs or reduce protein or increase protein when we don't know their body efficiency to breaking it down. We can't stuff down protein a cancer patient's throat when they don't have the right amount of stomach acid to break it down. And that is where complementary and integrative medicine fits in. Chemotherapy will deplete stomach acid, which is why we give antacids, because the possible nausea and acidity is going to happen. But how will you digest protein if you have less stomach acid? So there are simple natural foods which stimulate stomach acid. So now a patient is going through chemo, eating to create the right amount of acid, digesting food, less nausea, less constipation, less loose motions. Emotionally, the patient feels stronger to take the next cycle. It's not about chemo's good, chemo's bad. There's good chemo, bad chemo, good nutrition, bad nutrition as well. It's about what does the patient need? What does the patient need? The amount of people stressed out going in through chemo. I want to give you one example of a case. We have many. The power of the mind. Am I saying if you think positive, you can reverse your cancer? Absolutely not. In fact, thinking positive is toxic because we can't always be positive. And now you think, oh no, I'm getting negative. What's going to happen to me? But the placebo and nocebo effect. We had a 73-year-old lady with breast cancer. She needed to go through a couple of cycles of chemo and radiation. Her children didn't want her to know that she was going through that. Okay? So what the doctors and the team told her, you're just getting IV nutrition. She never knew she was getting chemo or radiation. She didn't have one single side effect. Not one single side effect. Again, what does this show us? Possibility. Am I making a statement that, oh, don't tell anyone and they'll be fine? No. It shows us hope and possibility that there is much that we can do beyond medicine. Not without medicine, beyond medicine. So when I integrate a chemotherapy, radiation, surgery, with nutrition, with exercise, with sleep, with emotional wellness, with nature, with sunlight, everyone says, oh, inflammation. Every cancer is an inflammatory disease, and so is Alzheimer's, diabetes. 93% of the diseases are inflammatory. People are like, oh, what are the best anti-inflammatory foods? Okay? We don't understand that sunshine produces subcellular melatonin that gets stored in your skin, and it is the most powerful, scientifically documented anti-inflammatory ingredient in your body. So now does that inspire us to get a little bit of sun? 10 to 15 minutes of sunshine. Will it cure your problems? No, but it definitely will make you better, right? So now when you look at lifestyle of people, everything I spoke about today is lacking. So how can people truly heal? How can people truly get better? And that's the difference. When you get into the cancer warrior stories, there is a marked difference between what they did over and above medicine, whether it was their mindset, their attitude, or the changes that they made. There is no magic diet. You can't say a raw diet is going to take away your cancer. You can't say an alkaline diet. These are all myths and fads. It is what your body type requires when you are going through that treatment. It's dependent on whether you have other conditions like diabetes. Do you have high blood pressure? All of these things have to be taken into consideration when you are eating for a particular disease. But the word that I want to leave you with is angiogenesis. We have all learned it. You have learned it in medical school. We have learned it in nutrition. When you break down angiogenesis, you will find hope, possibility, and many things that you can do over and beyond just the medication you take. And that is the power of integrative medicine. Today, top hospitals around the world, whether it's Sloan, Mount Sinai, everywhere, there are integrative medicine wards. Why? Because it works. It's not about which is more powerful. It's about the patient and what the patient needs for their overall healing. So we can treat symptoms, which allopathy is great at, needed, can save lives, but we also have to integrate practices where we can address potential root causes, bring in nature, bring in lifestyle changes, and work with the symptom for the overall benefit of the patient. My time's up. Thank you for listening, everyone.